Hello, I'm here with Dr. Jasmine Nebhrajani. Jasmine's an emergency room physician at Palm Beach Children's Hospital. Jasmine, thank you very much for joining us.
Thank you for having me.
Jasmine, I understand you're on your way to work. Could you describe for us what a typical day for you would be?
So I wake up every morning. I try to get 20 to 30 minutes of exercise in before going into work. I make myself a good cup of coffee that I drink on the way to work. When I get to work, I put down my bags and I work in the emergency room. So everything when I get into work is pretty fast paced. I generally sit at my computer desk, see which patients need to be seen, unless there's a patient in the recess room that needs immediate attention, where I'll go to first. Then I'll sign up for patients, the ones that need to be seen in the order of highest to lowest security, so the ones that are the most sick to the least sick. And then I'll go ahead and start my day and start seeing patients. I'll generally try to bunch and see about 5 to 6 patients at a time, and then when I get to my computer, put in all my orders.
And your shifts are 12 hours long, right?
Yeah.
You must be very tired at the end.
Yeah, they're super tiring, especially if we're seeing a lot of patients. Usually we see about 30 to 40 patients per pediatric ER physician in the emergency room a day. So yeah, it does get pretty tiring.
And what do you most love about what you do?
I love that I can wake up every morning and feel excited to go to work. I'm happy to go to work and excited to help kids feel better.
Jasmine, the career path to get where you are now takes a few years. Can you walk us through it?
Yeah, more than a few years, Peter. So most people get interested in medicine usually around high school. So that's 4 years of high school. So you graduate with a 4-year high school degree. If you don't take your high school degree, some people get their GED to substitute for their high school degree. And then after high school, you need to complete pre-med classes. And usually that requires going to a 4-year college. Sometimes you can get away with going to a 2-year college and then adjuncting your pre-med classes, but there's so many pre-med classes, it usually takes a 4-year degree, and you need a 4-year degree to start to apply for med school. Mm-hmm. So that's 8 years, you're already thinking about high school plus college. And then it's 4 years of medical school. So if you go straight from undergrad to medical school, that's 4 years of medical school. A lot of people generally take 1 to 2 years off in between undergrad and medical school to get a master's degree or do some extra research to make them competitive for med school. Med school is pretty competitive. You have to take an MCAT. It's a standardized test, similar to what you take for the SATs, but to get into medical school. And then after medical school, you do at least 3 years of residency. So that's training, and it really depends on what specialty you want to go to. Surgical specialties generally require more training, so the residencies are a little bit longer. They can range from 5 years to even 8 years for neurosurgery. And then pediatrics, so for me, I had to go into 3 years of residency. A lot of the times after residency, there is an option to do fellowship, so that's even more training. So yeah, there is a lot of training involved, but I do think it's well worth it.
And you did your undergraduate at University of Florida, your medical school at Nova Southeastern, and your residency here in Miami, right?
Yes, exactly.
Fantastic. Cast your mind back to when you were in middle school and high school. Did you always want to be a doctor?
No, actually, I didn't always want to be a doctor. Just like any middle school or high school student, I was curious in a lot of things. I wanted to be a lawyer for a little bit. I actually majored in political science in undergrad. I loved law and policy. So, those are careers I tried to explore, but at the end of the day, medicine was my calling.
Absolutely.
Yeah.
Besides you switching, majors or not majors, but switching careers after graduating college, is there anything unusual about your career path to date?
Yeah, so one thing specifically is I didn't major in a hard science in undergrad, so I majored in humanities, so political science and mass communication. So that was my first unusual thing. And then after undergrad, I did take a year off, where I got my master's in biomedical science. And in that year, it really solidified the fact that I wanted to go into medicine. So my advice to a lot of people out there is, take your time in knowing and understanding if this is something that you want to do, and explore other career paths, especially when you're in undergrad and in grad school. Those are times to explore other interests as well.
There are people watching this who know that they definitely want to become a doctor like you. What piece of advice would you give for them to accelerate that ambition?
So there's going to be a lot of people that tell you that you didn't get enough of a high score on your MCAT, that you didn't do well enough in your science classes in undergrad, but if it's something that you want to do, I truly believe there's always a means to an end. So if it's something that you're passionate about and you know 100% you want to be a physician, go for it and don't listen to those people.
If you can imagine yourself in the future, 20 years in the future, where do you think you'll be, and how much do you think the role of a physician will have changed by then?
That's a really good question. In 20 years, I think that we're going to be reliant on technology a lot more than we are now. Medicine is the slowest growing field technologically wise. So I think in 20 years, we're going to be using technology in a different way that I couldn't even possibly imagine. I think the day-to-day, especially in the ER, is going to be quite similar to how it is now in 20 years. I mean, you're still going to be going into the emergency room, treating highly acute patients, advocating for your patients. I do think some ways technology is going to be intertwined somehow, and you guys will be great at it because you're all, so technologically savvy, even more so than I am.
So Jasmine, in the emergency room, it's not just physicians. Can you describe some of the other roles that your colleagues may have?
Yeah, so medicine is a team sport. It doesn't matter where you practice, in the ER or in a clinic setting, or even in the hospital. It's a team sport. There's a lot of numbers and people involved. In the emergency room, hypothetically, you walk in, you register with someone initially. That's the registration person. They take down all your information, they take down your chief complaint, they put it in the system for us to be able to see. They take your insurance card. So that's a very important step in the whole process. After that, you're triaged by a nurse. So you talk to a medical professional who places your complaint in an acuity level to kind of help the doctor understand how sick you are. They take your vital signs, your blood pressure, your heart rate, your temperature, put that all in the system, and they put your chief complaint in. And then when you're walked back into the emergency room, you see another nurse who then is your assigned nurse in case that the physician orders any tests, lab tests, urine tests, x-rays. That nurse is going to be really in charge of you as a patient. You have to remember, in the ER, there's one physician for 10 to 12 patients, but each nurse has 2 to 3 patients. So that nurse is going to be your highly specialized individual in the ER. And then after all these people come see you, you have the physician that comes and sees you, and they order tests. So if you have a blood test or a urine test, that's what the nurse does. If you're a very sick patient and you need respiratory support, you need help breathing, we call a respiratory tech, and that's another role for a medical professional in the hospital. There are x-ray techs that come in and roll the patient to the x-ray room and take the x-ray. There's CT techs, CAT scan techs that come and take the patient to a CAT scan. If the nurse somehow can't get a blood test, we have people from the laboratory come and do the test. And then when all these tests get accumulated, people in the lab are also there to run these tests. So yeah, there's a lot of moving parts in the emergency room.
There's a lot of opportunity in medicine for people of all interests and backgrounds to get involved, right?
Yeah, exactly. So it's not always let me be a doctor. There's so many aspects in medicine that you guys can be involved in.
Your role is not limited to your impact in the emergency room. You've been featured on local news channels giving advice to parents and children. Have you enjoyed that?
Yeah, so I, especially this year, I am working with channels 5 and 7, and I do short little clips and not documentaries, but short little clips kind of explaining about ailments in the pediatric population in West Palm Beach. So yeah, I really enjoy that. It's another avenue to explore in healthcare and medicine. If you enjoy speaking on camera, advocating for your patients, then it's something definitely to explore.
Great. Dr. Jasmine Nebhrajani, thank you very much.
Thank you so much.